Okay, welcome back to another video of advanced functional therapy philosophy and the foundational assessment. So next, we're going to talk about one of the most important areas in the middle of your assessment is the align action uh, section. So we're going to look at their function, their observation of how they see themselves. What are their daily patterns? What are they doing in the environment? We're gonna look at what has changed with their diet that has caused inflammation, what they do for work, the injury that they are dealing with, how it came about. Really, is we're trying to reverse engineer the body to figure out how the body adjusted and adapted to get into this dysfunction or pain response. So at one point in their life, they were healthy, and then at a now point in their life, they are in dysfunction. But in between there's a reason why they are having this dysfunction. And if we can't find a acute injury, an accident, a surgery, something traumatic that happened to the body, then there's going to be slow patterns that their body has been adapted to throughout their life and lifestyle to get them to this point of dysfunction. So our job is to play Sherlock Holmes and to really look at the body, look at their intake, look at what they're telling us, their observation of themselves and how things change in their life, to come up with a really a reasoning to see how they came to this point and what was the wrench that was thrown in the system to kind of break the machine, if you will. So with the align action, we're gonna take the patterns that we recognize from the past observations and intake, and then we're going to figure out what actions of treatment can you take to adjust the minimum amount of tissue to achieve maximum result. So we want to do the least amount of therapy possible. In our job, we're using our body all the time, and the less we can use our body, the more patients we can help heal, because we're not going to be burned out. We're going to have energy to be able to give to others. So and you're going to be able to take more clients throughout the week, and really have energy afterwards and not be so tired. So this is going to really advance your practice, or your client intake, because you're going to be able to do less, and you're going to be able to have better results, and then have more time to take on more patients. So we're going to look at an image here, an example of a client of how we would work with her to do the minimal amount of work possible to get the maximum results from her issues. So she is coming in, she is having neck pain, she is having headaches, she is having upper back, mid back pain, she is having some hip pain with sciatic coming down her left leg. So, and right shoulder pain. So we're noticing right now, based off the assessment, based off what she's told me, she works at a laptop and she works at a office where she's kind of going in different places throughout the day. So she doesn't have a desk of her own. She's working from her laptop, and she's really mobile. So she's not always in a place where there is the best ergonomics. So we're looking here, we're looking at she is in that clamshell position. Um, she has that anterior tilt, um, and that anterior rotation of her shoulders, and she's leaning over. Her head is looking down. She's not able to separate that monitor from the keyboard to raise that monitor up at eye level, so she can sit upright. So she's sitting for hours in this position, leaning over, holding her phone, and then typing on the computer so that she can have dual screens. So this is not an ideal position to be working day in and day out, but this is what her job entails, and she has to be mobile. Um, so we're kind of trying to work with what we have, and see how we can, one, reestablish that position of her body so that her metabolic flow can be restored, her body can heal, and she can restore the vascular function, nerve function, um, and all of the metabolic functions that are needed for health. So when she comes in, we're going to be assessing her posture, going to be taking into account what's going on. But typically, therapists come in and they work that back line. They work the actual pain point, which is going to relieve the pain, but then it's going to worsen the condition. So let me show you an example from a anatomical view of what we are looking at here. So if she is in this clamshell position sitting forward, all of the gravity is pulling on her upper body. So if she's, can't really tilt this thing forward, but if she is crunched forward, her hip flexors are going to be very compressed. You can see how our vascular system is running through this pelvic floor here and through the hips. So if this is compressed, this is going to cause a lot of issues with the lower limbs. Her abdominals are going to be compressed because she's leaning forward. She's going to have this anterior rotation of that shoulder. So the chest and the deltoids are going to be really tight. And this nerve plexus here is going to be impinged if that gets too out of balance. So her pain is going to be in the back line because these muscles are holding tone to keep her body upright from gravity pulling her down, which is acting like a strap and compressing and kinking the hose of the vascular system. So then the body is going to have the pain response, say, hey, human, something is not flowing properly. Let's take a look at this area to see why it is not flowing properly. But this is not the actual source of the problem. The source of the problem is the body, the physical structure not being in its correct position. And these muscles are pulling forward, but they're doing what they're supposed to because they're adapting to the environment that she is working in and day out. She's having headaches. As we know, we have the cervical spine and we have nerves that innervate into the face, into the head from the spine, and anything that is going to be compressed is going to compress on those nerves as well, causing cluster headaches, causing migraines, causing a lot of issues in the face and neck. So we need to bring this position back so that this head is not rolling forward to put all this pressure on these neck muscles to hold the head up from falling over. Coming down to the hips, she's having sciatic pain. So this sciatic nerve runs down through this pelvis. Is she sitting and shifting to one side of her buttocks when she is working? Is her pelvis tilted at all? Possibly, most likely. And all of the pressure is going into the sacral area because this is the top of the triangle. If her legs are coming out in this clamshell position, the bottom of the clamshell, the upper body is the top clamshell, and this is the actual point of the triangle. And a lot of pressure is going here, so these muscles are going to hold tone around that area as well. And if it's too tonic, it's going to put pressure on that sciatic nerve and cause that sciatic pain. So we need to really look at what areas are we going to work with the kinetic chain to get the body as close to anatomical position as possible, but not waste our time working on areas of the body that don't need to be worked on. We can still work the back line, but we're not going to go in there and dig and really compress on those trigger points, because it's going to loosen up this area and cause the anterior body to tone more, because these muscles are actually contracted, pulling the body forward even more. So it's going to relieve the pain temporarily, but overall it's going to worsen the condition and pull the body forward more, causing gravity to pull even harder and causing these muscles in the back to contract even harder as well, to hold the body up. And then we have an issue with the cervical spine being out of alignment and those nerve innervations being cut off. So, our our disc need to imbibe fluid and they need movement. But if they're stuck in a static position and they cannot move, then they're not going to be healthy. And then we're going to start having spinal issues. So this is something that, we're going to be covering in detail over each common type of dysfunction that I see in my patient load. So there's typical patterns that most people have, depending on their past history, depending on what they are doing in the world, activity wise, extracurricular, as well as their profession. So just working smarter, not harder, is the best. Once we can have a line action of knowing what we have to work on, we might only get to one portion of the chain this session, but we can inform the patient that in the next few sessions, we're going to work with the chain, and we can plan in advance of what we're going to do to restore the body to its normal positioning, to then take off pressure of the vascular system, lymphatic system, and to restore its metabolic function, to get the body to heal, to get the body to repair, and to take that physical stress off of the body. So like I said again, any dysfunction on the body is going to be either from chemical stress, physical stress, or emotional stress, or all three together, a combination, which is going to put pressure on the body, imbalance the body. So we need to be detectives and reverse engineer the body to look and find out what stressors are on the body, build a plan to get their body out of that compressed adaptive position back to anatomical position the best we can so the body can heal naturally. See you in the next video.